Come in.
Hi, my name's Abby. I'm going to be your nurse today. I'm going to be doing a head-to-toe assessment. I'm going to wash my hands and give you some privacy. And can you tell me your name and date of birth?
Ashley Hagen, 6/21/01.
Awesome. Can you tell me the month and the year?
November 2020.
Now, this just tells us that she's alert and oriented to the situation. Now, what brings you in today?
I'm having some pain in my abdomen.
Okay, on a scale of 1 to 10, how would you rate your pain? 1 being little to no pain, 10 being severe pain.
Probably like a 6.
Okay, now we're gonna try to get that under control for you. So now I'm just gonna start to roll through my head to toe assessment, and I'm gonna start with your respiratory. If you don't mind just swinging your legs here. I'm also gonna evaluate your chest, but for the purpose of this video, I'm not gonna do it for the full minute. So we're gonna assume it was even, easy, and deep. Now I'm gonna go ahead and take a listen to anterior, posterior, and lateral fields. So when I do this, just take some nice deep breaths for me. All right, everything sounded good there. I'm just gonna do your lateral, just 3 different spots. All right, awesome. Just do your other side now. Perfect. Now I'm gonna listen to your back, so if you could just have swing your legs that way. Just move your hair for you. Just breathing. Awesome. Taking those deep breaths. Great, everything sounded good. So now we're gonna assess your cardiac system. So I'm just gonna listen to your heart. I'm gonna go through the different listening points. Just breathe normally for me. Listen here. Great. Just gonna feel for your actual pulse, your PMI, just make sure everything's okay. The apex seems to be in place. So now that we've done that in your 5 different areas, everything sounds good and normal. We are gonna go assess your stomach. So you can just lay back down. Just gonna inspect it. And due to COVID, we're not gonna remove clothes, but to inspect, you would see that it's normal in color and there's no lesions or rashes. So now I'm just gonna listen to your stomach. Did you have breakfast or any meals today?
Yes.
Okay, awesome. Seem to always put those on wrong. Okay, so I'm gonna listen in the 4 quadrants. Your belly button. Feels warm, which is normal. Now I'm just gonna do some light palpation. And let me know, do you feel any tenderness in any of these regions that I'm touching? Okay, awesome. So I'm gonna have you sit up and we're gonna look at your different extremities, both upper and lower, and just sit back. So first I'm just gonna inspect your skin for any rashes, lesions, anything like that. It's warm, normal. I'm gonna check for your capillary refill on both your fingers. I'll assess your other. Everything looks normal, warm, your cap refill. Less than 3 seconds on those. That looks great. I'm gonna take your pulses. Are you doing pulses? All right, it's normal. Rounding. All right, awesome. So now that we've done that, I'm gonna take a look at your lower extremities. Your legs, Everything looks good. No lesions, rashes. Take a look at your heels. No ulcers or sores forming. That's all good. I don't see any edema on either, which is good. Now I'm going to take your pulses on your feet. Awesome. All right. That's all normal. I've inspected, palpated, no swelling. Everything's good there. I'm now just going to make sure I put up your safety rails. You're in a low position and give you your call light in case you need anything. And the doctor will be right in to help you.
Thank you.
Of course.